Assalamu alaikum.
Wa alaikum salam. I don't have the video. I'm just trying to share the screen. For some reason, we're just trying to figure this out really quick. Okay. If not, Brother Abdullah Mitchell, I might need you to share your screen of the slides. You have it too, right, as a backup?
Yeah, that's why I sent it to everybody so we can have a little redundancy.
Yeah. So right now, my nephew's kind of, for some reason, let me just see. Okay, so if I go to, I'm just gonna play around for 1 minute, Shakes. All right, Brother Mitchell, and I'll get right back to you. So should I go to System Preferences?
Assalamu alaikum. This is Shadi from Ikna Relief.
Wa alaikum salam.
So, Brother Abdullah Mitchell, are you able to see this, Sheikh?
Here, just a minute. Let me get to the screen.
I just want to see if my screen's been, my nephew kind of helped me out here.
Yeah. Yep. I can see it.
Right, so please make dua for my nephew, Zakir. Get here. I'm like, all right, something's going on.
It's always good to have those kind of resources at hand, huh?
Oh, yeah, mashallah. I woke him up too. I feel bad. I called him. I was like, you need to come down here really quick. I know I came to your house and I took over your room, but subhanallah. Yeah, no, I appreciate it. Thank you so much, man. Yeah, with this online, it's always that technology. Just because you always feel uncomfortable, I'm like, oh boy,
Well, even in terms of this experience for myself, there are certain things that you did earlier. Now they changed because they impose what they consider security features on you. Just like here, when you used to send this just as a link, it gave you the
right
in the password. Now they don't give out passwords anymore. So
I know he had to go back into the system settings. They said, no, you got to get this off for you to open it. I'm like, oh, okay. So I didn't realize I had to change something in the system.
Those are like some preliminary remarks to just set the tone.
I know that's good. We needed to have those disclaimers, so I'm happy. Okay. So I could just keep making it go down when you're talking. So you just tell me the slide next, and I can do that.
Oh, okay. Because right now you're controlling it.
That's what I'm saying. So what I could do is when you're talking for the first few slides.
Oh, I see what you're saying. Next.
Just in case we switch over and something happens again, I didn't want to take that risk in front of everybody. So, because if it's 5 slides, I could move it down for you if that's okay.
Yeah, that's fine. No, that'd be better. Good with one person controlling it,
right?
Flipping back and forth.
Right, yeah. So I just thought.
No, agreed. So are you guys going to reopen?
No, realistically, with this going on, and that's why I wanted to kind of have that disclaimer starting and saying, look, as things change, please, we need to just kind of go with the flow. Right now, if anything, it would be a hybrid if you do it, but I don't think there's going to be no full everyday kind of class. If that happens, if not, it might be the first quarter we go completely remote.
Yeah,
and things get better. Which this is what it's looking like, more and more, from from what we're hearing in some other states right now where the numbers have gone up. Like California was going to go completely, in person, but now they switched. Seattle just did that, right? So there's this conversation, but they're letting private schools make that personal decision. But I think it's I would always recommend people look what your district's doing, because right now the states are not letting us. They're not going to exempt schools from liabilities. So if you're if we're still going to be liable, so we just got to be, you want to be very precautionary in that sense.
Well, another thing I think is important is to have people from a legal point of view. It's one thing to have a disclaimer and have people sign waivers, but you at the same time must exercise all reasonable precautions and protocols, because the waiver won't do any good if you're not doing what you're supposed to do.
That's true. It is true. And that's why I think the state gave just basic guidelines, because they don't want to do this because of something that's going to okay, just keep.
Yeah, they don't want to be sued either. Everybody's running for cover.
So,
let's see. That's why they, when you get a big shot like you, that's why you're there to make those kinds of decisions. I see. That's when you find out who your friends are, huh?
That's what we had the meeting with the Deputy Governor Jesse Ruiz. So we sat down with him, and then he's the one who brought it up. He goes, like, you guys are not, we're not exempting you guys from liability. So please make sure you follow all the protocols and follow through, parent side. At least you're doing your part.
Yeah.
Right. The only people that gave waivers is to the doctors and medical. So I'm going to kind of remind everyone, like, look, what we're just talking about is please look over, do your own research, talk to your health professionals, talk to your lawyer. And so,
Assalamu alaikum. This is Irshad.
Wa alaikum salam.
So do we have a hard stop, Brother Habib, at 11, or you have some time?
I'm good. I'm good in the sense of at least, 11:10, we should be okay. And I would
Got it.
I just want to give
But
myself
depending on the Q&A, just wanted to make sure that, I know we talked about your being out of town, and
Right.
appreciate your taking time and accommodating this.
No problem. I appreciate you guys doing 10 o'clock because that gives me more time to kind of like, be, involved in today's meeting. Because 10:30, then I would have had to stop by 11:15. But if I got 10, I could go until 11:15. So it's perfect.
So, Brother Mitchell, are we all set? You got everything, slides, full screen?
Yeah, look at your email. You got it too. Everybody has it. So whoever's
Just in case.
Kind of redundancy is the rule in IT, as I understand.
Yeah, we always live. Yeah, it's good.
I'm just going to get my charger, so just give me 1 second. What time is this? So she should be by it. I know she must have. Hey, the White Sox had called about a month ago. I don't know if I told you about Abdullah Mitchell. I was like, yeah, but with the COVID, I don't think there's no games happening.
Yeah.
About a month ago, because this year they wanted to do a bigger thing, like, it worked out so well. I think we want to open up the food opportunity for you, and da da da. I was like, okay.
No, that would be good, but like you said, you don't want that to be your last supper,
Subhanallah. Yeah, so.
Because it is, I don't know, I don't want to say scary, but at least I think it's more people recognizing this is not a joke. I mean, there's still people out there. It's just amazing how people are acting like you don't need a mask, and next thing you know, then they're in the hospital. So
that's so true.
And particularly as it relates to the subject today, it's important. Just like opening the mosque is important, but if we don't follow protocols,
yeah, I've seen some from other states. There's been some people that they had to close back because of the numbers.
Yeah, I know. I worry because my son and daughter, their kids are in preschool, and I'd prefer that wouldn't be, but what can you say? All right. Well, Habib, it's 10 o'clock. So, I mean, if you want to wait another minute, I can make that announcement, or
sure.
Give a few more minutes for people to get. Okay.
I got you. No, that's no problem. No problem. I have at least an hour 15 to hour 20, so we're good.
Okay. All right. So inshallah, we'll start at 11:05.
Okay.
Now, if you want, on your display, if you hit slideshow and then hit from the beginning. That way you'll have a full screen view
Oh,
of your
good.
of the participants. But once you start hitting those keys, you know, it'll jump on you. So, but that'll be
So should I play from
from
start?
the beginning. That's going to give this one the first screen. Yeah.
Okay.
Yeah. Now, when you hit any other keys, yeah, hit the back. Yeah.
Gotcha.
All right. Okay. All right.
Uh,
668714.
Yeah.
Okay.
A lot of people.
Yeah. There's a lot of blingings now.
Yeah, people come. I know a lot of times that password because everyone forgets to write the password down. And
Yeah.
What was the password again? You can go back.
I know. And now, like I said, with this newer security change, it makes it even
Right.
more of a challenge.
Yeah, that makes sense.
Okay.
Because most everyone logs in like at 11 and they're looking. Forgot. So no, I think it's good to wait a few minutes.
Yeah, most definitely.
Uncle Habib, how are you?
Yeah. Tomorrow, Cisna, they're with all the principals too. So about the same
is
topic.
that's what you're at, this meeting for that?
Yeah. Tomorrow is for all the National Cisna Council of Some Schools in North America. So I was on the boat on the same days, and I told him, hey, I told CIG, brought up, again, things are changing. So I want to it's very important to understand that what we're saying, it doesn't mean, is CIOGC saying we should go in-person school? No, but we have to realize when we were planning this, that if we go in person, what would it look like, or what are some recommendations? Again, you would have to speak to your local health department. You need to look at from your own advisory team that you might have set up, to even speaking with your lawyers to kind of say, hey, look, what are the circumstances? So I think that is very important, as before we begin, to keep those things in mind, even having a set of surveys. So what I wanted to do was first to start off with some survey questions that we had asked our parents, and I've had shared this with other Islamic schools, these questions too. Then kind of go into if we go in person, what it would look like. Remote learning just yesterday, and I think I sent it to Brother Irshad Khan, so he should be emailing that to you, is the new guidelines for just remote learning. There's some updates with that just came out a day or two. So I did not put that into the presentation because that is something new, right? From about a month ago, it was just like, we got the guidelines. A few days later, we just kind of told you guys what the guidelines stood for. Then we were planning on, if we go in person, what it would look like. Now that remote learning looks like more, they put a new guidelines which came out from the state just 2 days ago. So there should be, it's like a 45-page packet. So I just want to give you guys a heads up. That will be also emailed to you. So as long as you gave your emails, inshallah ta'ala, we'll be also able to forward that too. So just want to keep you guys with that. So here's a few things just to kind of give an idea. One of the first things is just to ask some questions to your family, just to kind of give you, we did 2 surveys and we have a 3rd one coming up this week. But the first survey was just basic information. I'm not going to go through all of it, but just to kind of tell you, this one was about, if we had to wear a mask, are you going to be okay to wear the mask? 60% said yes, 40% said no. But those were a lot of the early childhood parents. We also had an opportunity to figure out like which age group they were. So it kind of gives you, so there was this concern that early childhood parents, like for 5 hours, this might be too much. So kind of give you like some idea how that might play a part. A second question to the survey was asking that if we go at live streaming the class, right? If we had to live stream the class, would you be open to that? Would you be available or comfortable? So 44% said yes, it'll make my child feel included in the classroom. 39 said yes, but it would be hard for me to take my child to be online for 5 hours. And then 16% said no, this sounds like too much time. Just give me the e-learning lessons and some recorded instruction. So what it does is gives you an idea what people are thinking. So that's something like for you to ask. We have about 380, 400 families. We got about 278 families who kind of responded. So it kind of gives you an idea of that thought process. Again, just anyone who just came in right now, we're just going over quick some survey questions that just things to think about, but we are going to go right into the protocol and options just in a few minutes, right? Another thing that you might start seeing is that we had asked the question like, look, if you have a child has a 100-degree temperature and or has like cold flu-like symptoms or severe allergies or sneezing, you might have to go home for 72 hours. Are you going to be okay with that, right? And then you'll have access to live instruction and e-learning. Are you prepared for that role in that new procedure, right? So 79.5% parents said yes. And this procedure gives me confidence that my child will be safe as possible at school. Yes, but it will be difficult for our family to provide childcare at home. We wanted to figure out how many people are going to struggle with that childcare situation, right? Then 13% said no, and another in green says no because I will struggle with childcare. So we realized that there's another 5-6%. The reason they said no is because of the childcare situation. So these were questions to kind of give us some more information. Played a big part. Number 4, then we just asked, hey, 5-hour school. We realized that if we are going to go remote learning, in person, again, the things have changed. When we were first planning, if that we're going to go in person, would you be okay with 5 hours that your child has to wear a mask, right? So we had so you see the percentages, 73% said understand, 44% yes, I think this will help limit the spread of the virus. No, because I would like my child in school until 3:40. So they wanted like the whole day to be at school. And then so it kind of gives you an idea because I will not have any childcare after classes, the school ends. So they realize if we finish school at 1 o'clock, this is the problem for about 8% of the population. So that helps us also in making our decision-making thing. And we'll be glad to send this whole slide to everybody too, just to kind of see some of the questions that we were asking. Then the other one came out regarding, guidance for reopening schools allows flexibility for schools and social distancing. So that played a big part in asking and saying, but because that if we had everyone at school at the same time, this is again, you have to think about the first initial survey. If you have everyone at the same time, they might not be 6 feet apart, right? Which could be problematic. Are you guys gonna be okay with it? 50% said, hey, you guys will do your best. Another 23% said, no, if it's not 6 feet, we're not sending our kids. And another 25 just said, hey, no, not at all. We're just not even bringing the kid. What it does is helps us understand, well, there's a divide. There's a 50% this way, 50% that way. Helps us understand that, look, and you'll see later when we talk about this, why the hybrid model, even in Chicago public schools, and everyone's going like, hey, we have to do a hybrid model where you're going to have to break that class of 25 into 12 kids, right? You could do 3 days in and 2 days out, 1 week in, 1 week out. Everyone's going to have different forms of that hybrid model, but kind of gives you guys some things to think about as we go forward. Then you have this other question about what happens when someone who has been at school tests positive for COVID-19 and say, look, if you get tested for COVID-19, that means all of us have to stay home. That class has to maybe stay home for 14 days. Are you going to be okay with that? So you'll see that majority of people understood that. Yes, I'm glad that this safeguard is in place. Another 30% say, yes, I have my child ready for this possibility. So yes, but I would have hardship providing supervision at home or, someone to watch the kids. But what it does is helps us understand. Then you realize there's a few parents who say, no, I'm not ready for this possibility. No, I disagree with this procedure. So you'll have some people who are like, well, I don't think anything, this is nothing wrong, this is becoming a little bit more exaggerated than there are. So you always have different people with different mentalities. And a lot of times it could just be, hey, they just need someone to watch the children because they have to go to work. So you'll see that these are things that for us to also understand the psyche of our parents and I say how we could try to see we could accommodate, right? So then you had another question to sometimes to think about is saying, hey, look, if you do recess, I know that it's going to be 4 hours, 5 hours of just straight instruction. We are going to limit some of this interaction. So if I understand that we want to have that bonding time, but just for the safety security, do you understand that we're going to have to limit specific things, even if it is something like a gym class is going to be very structured, more stretching, not heavy breathing. It might be in small groups. Are you okay with that? And parents understood and said 77% say yes. No, this sounds too restrictive. Then we have a lot of people, we gave others where people could give their comments. So we had various comments that were given. So it kind of helps you understand this process. And the other question that, something to bring about was just the psyche of the child. How is your kid doing, right? So we asked, like, how's this been socially, emotionally impacting the kids? So we kind of looked at that. Some parents said, hey, minimal impact. We have been able to connect with others and keep things positive. Some said some impact. My children miss their friends and routine, but they are doing all right. Some said much impact, and some said serious impact. So it kind of gives you an idea that, hey, we just wanted to see, like, okay, when we're coming in, is there, do our school counselors need to be aware of this, right? So that's one of the reasons we just kind of ask that question also. And then maybe even the class, sometimes we need to, first few days, just to try to get them to bond with each other and talk to each other. It might be very important. And the other question just came up was, if we just did in person, are you planning to send your child to the MCC, right? And just to kind of give an idea, if we just did in person, what would you do? You know, some say yes, some say no, only if certain requirements are met. And then people gave a lot of different kind of things of the 6 feet and stuff. So that was the first initial, as we said, survey. The last question was, now that you know it's 8 to 1, you know, would you send your child, you know, understanding that there won't be no lunch, no congregational salah, no nap time, early, you know, for early childhood, you know, with all these restrictions. So 66% said yes. Then you had the other ones that said no, and a few other things. So it kind of gives you some thought process. So that was the first initial. Then the second initial survey that we went into was kind of talking about, okay, if we have in-person school this fall from 8 to 1, which option would you prefer? Knowing that from the first initial thing that we realized that social distancing was a concern. If you had the whole class school come, whoever wanted to come, and whoever didn't want to could be online. But then we said, all right, what happened if we divide and break that class a little bit more? And say 1 week model where half the class comes in, like a class of 25, 12 kids come in one time, another 13 kids to come the next week. How many of you would be okay with that? So 34% said, hey, that would be something that would be great. Then when we asked, what about if it was a 3-2 model where one class of 12 come 3 days and the other class comes the 13 come the other day, and the next week you flip flop. Would you be okay with that? And, you know, we had people say, hey, we'll be good with that. And then I'm fine with either option, right? So you saw individuals who were kind of open for both options, you know, which played a big part. Then we had this, you know, other question. Again, we're going to be sending you these slides, so don't worry, just because I want to go into more of the protocol, but I just want you to kind of think about some of these things that were discussed, is if our state or school council dictates that due to the numbers of COVID, school will have to remain virtual this fall. Are you still planning on sending your child? We just want to know, look, if we're just go remote, because we're private schools. For private schools, it's tough because there's a whole tuition base, right? And so we were trying to figure out, okay, if we went completely 3 or 4 hours of online remote instruction, how many of you would still come, right? And we reminded them it's going to be different from the spring semester. And then we had 70% said yes, and then 19% said no. So it kind of helps us kind of find out. Again, I'm going to have Q&A at the end. So, you know, I'm just kind of going over some of the slides now, and then we'll kind of come back to any questions you have. Number 3, if we have remote online learning for a portion of the year, we said, okay, maybe for up to the first quarter, right? This is something that a lot of us are considering now, that let's figure out until things get better. Do we go until November, first quarter, all completely online? Would you be okay with this in person, right? So out of 253%, we said 75% said yes, 13% said no. Then we have a lot of people with different, you know, comments and stuff. So what that does is helps you understand your group, right? You know, as Brother Abdullah Mitchell had stated, every school has its own dynamics. Your space, your support, your staff, you know, the area is your area more. There's a lot more infection and so on and so forth. So I want you to realize even the state now has broken down to 11 different areas. So because they know that everyone's at different situations are how the COVID is in that area. So those were some questions. But now what we're going to do is think, if we go in person with the hybrid model, I would tell anyone, don't just go completely full force unless you have a small school, because some school might already be small enough where you could go every day because the classroom sizes are 8, 9. Again, looking at what it is, because some states like Los Angeles which was going to go completely in person, had to flip because the numbers went up, right? So a lot of states that we're going to they're not even doing the hybrid right now. So I want you to kind of keep these things in mind. So you got to figure out what's going on locally, what's going on with the health department. You know, like we're close to Skokie, so we have a specific Skokie public health department, so we're talking to them. So please keep these things in mind. So when we're going through these slides, I don't want you to be like, oh, CRGC said begin. We didn't say begin. We're just saying, if this happens, these are things you're going to have to keep in mind whenever that is. If that's in November, December, if that's in January, that's in February, there are some things to think about, but there might be some new guidelines as they're coming in too. Just like I told you a few days ago, they just put the new remote learning guidelines of what should be thought about. So just kind of keeping these things in mind. So let's go with some of the protocols. So one of the first things that we, to keep in mind is every child needs to have a face covering. If they're not able to get one, the school should provide it. That is very important, because I think that's something that you're going to have to realize is something that's needed. So you'll understand that you have to provide that. School will provide face coverings to teachers, possibly N95. You want to make sure your teachers that we're providing, I think it would be very beneficial, or behooves all of us to at least say, making sure all teachers, at least we could spend the money to get the N95 for the teachers. And for any child who does not able to get a face covering, that we could try to provide them. And I would tell you always to have at least 100, 200 on site, just in case someone forgot to bring a face covering. So number 3, teachers who teach reading in early child can wear a face shield. So if they have their covering, but they will also want to make a face shield, it's something to kind of think about. Maybe it might not, it would be a good idea. So just want to kind of give you a heads up on that, that teachers who teach to have that plus the face shield. And then if they want to talk, they can pull it down and have the face shield if they need to, especially Quran teachers. But again, wherever the teacher feels comfortable, right? N95 is more protective than the face shield. So we want to make sure we follow the guidelines and making sure our teachers are also feeling comfortable. Proper signage should be posted in and around places where face coverings are required. At the discretion of the school, disposable facial coverings will be provided for people who arrive that are unaware of the rules. So you want to make sure you kind of keep that in mind. Cleaning supply checklist, something to think about. Do we have a stock of cleaning supplies? Do we have working soap dispensers, hand sanitizers, an adequate supply of paper towels or sanitizing wipes? Touchless is preferred, because you want to think about when you go into the bathroom, you want to think, hey, if they could be touchless with the hand soap, with the hands, even the toilet, where the ones where it's censored, but in case if the sensor doesn't work, you can still press the button. It would be something for us to kind of think about, because this is going to be the new norm. It might be, this could go on until the whole year. So this is something you want to really kind of go ahead and consider about doing things touchless in these specific cleaning supply checklists. And that will supply and what we'll request from parents and community. And the other thing you want to ask is, like, how you have your regular school supply list, you might want to think of now a lot of these checklists which are going to be provided for regarding health cleaning supplies. So thinking about what are things that you would like the parents to bring to the school would be very important. Arrival procedures. So this is important. So we're going to kind of go through the day now. We're going to kind of go through the day to kind of see what, how or what it would look like. And so one of the things that, you want to look at is stuff like temperature check device should be touchless. Check the temperature of the child in the car, because if they come out, they're already in the classroom and you're like, hey, you got 100, go back. Now you got that whole area where they're breathing, right? Or they might've touched something. So it's best to, as when I was meeting the different administrators throughout the United States and through our local coalition that we have for the Illinois private schools, talking to individuals, saying, look, it's best to check in the car, and say, check, okay, you're good, you could come out. Then have staggering times for drop off, right? You need 20 minutes because that way you don't have cars all backed up, right? You might be like, brother, if you check everyone's cars, it's gonna take all day. So having that staggering, making sure that you now have to look at your parking lot and say, how can we maximize that parking lot so we have enough where parents will have to wait a few minutes. We're gonna have 4 or 5 different temperature. Don't try to have one temperature check and have everyone waiting. You might have to have 4 or 5 different staff members checking and just saying, okay, you're good. You could get out of the car. Again, these are just suggestions. It's not mandatory. It's your thoughts now what to do. Have a few assigned individuals to check temperature. We talked about that. A temperature check of each student must occur. Any students with a temperature of 100 should not get out of the car and should go back home with their guardian, right? And even a question that you want to ask, the students should be asked of the following questions. How do you feel today, right? Do you have a fever or cough? Right? Did you feel sick? Because sometimes you have some parents. Now, I don't think for COVID they do this. A lot of times when parents don't have babysitting, they'll give them Tylenol and say, okay, for 5-6 hours you should be fine. Temperature's gone. Go to the school. And we've had those situations where hey, I was feeling sick, but my mom gave me a medicine, so that's why I came to school. So now it's like, look, if you're within 24 hours, you're not fever free, you're not walking in this building. So a lot of times asking the kids, because some kids will tell you like it is like, yeah, mom, you know, I really wasn't feeling well, but my mom and dad told me to come. So keep that in mind, inshallah ta'ala. Also, the other thing is mask check. A check of each student to ensure the masks are present and properly worn is very important. And then also the employees and volunteers also need to be checked too, even a teacher, because you know what, the teacher, if she's going to see all these kids, so it's got to go both ways. And I know that might be, you know, like administration, like, okay, oh my God, we might have to find subs. But again, the safety and security of the kids. That's why when I'm giving you all these things, you're going to have to look at it and say, well, are we really prepared to go in person? That's why you have to look at this information. So, okay, if we have to do some of these things, or these are recommendations, maybe right now for our school, that might be too much. So we might in person, and this is the reason why. And I think sometimes for understanding parents and saying, this is what in person will look like. Are you okay with this? That's why in those surveys, we had to ask, like, okay, if you someone gets sick, that means for 14 days, you have to stay home. Are you going to be okay with it? All these other factors have to play a part. So keeping that in mind. Parents and guardians should not enter the building to escort students. Now, early childhood in the first 2 days, you could 3 or 4 year olds because they're going to cry and it's their first time at school. Makes sense. But even after that, you want to limit, because the more people come in, the more problematic it could be. Entrances, have students assigned by the door. The door should be wide open so students do not touch the handle, right? So when they walk in, I know mostly for safety protocol, we always keep the door closed, but this might be a time where you have someone by the door. After they do the temperature check, they're coming, making sure the masks are in there, and the kids are now opening up the doors, is something to keep in mind. When entering the school, a child should be given antibacterial soap or hand sanitizer, right? After entering the classroom, have students go directly to their classroom and not to morning assembly. You don't want to have morning assembly. You could do it by the microphone in the classroom, or if you don't have the microphone system in the school, then each teacher is going to have to do the morning assembly. But having everyone together at one place, I would highly, especially with the limitation of 50, you really want to make sure that does not happen, because everyone's reciting out loud, they're talking. It's going to be problematic. Yeah, I know some of you guys are, well, at the masjid we have that, but that's because imams are only reciting, everyone's staying quiet. Morning assembly, mostly everyone's talking and there's announcements, and then you also got more kids closer together. So really would tell people, come in, backpack. You're not even going, we're even recommending not going to the lockers, right? Just because our lockers are close to each other. You might have a separate situation, but we have about 730 kids, so ours is a different ball game. So we're saying, hey, go right straight into the classroom. Even if you divide the groups, if you divide the class, you might say, well, we might have enough space to do that. That's up to you. So you got to look at your school and see where the lockers are. Are they going to be too close to each other? Are the lockers far apart? So we're thinking, hey, everyone just stays in their backpack so they don't have to go back and say, well, I left my book there. So we felt like if you have the backpack, all your books there, and that desk, you're staying for the whole day, things might be easier. So kind of things to think about. So in the classroom now, right? So we just went from in the morning, what to do, you walk through the building, what to do, going to your classroom. So classroom is the next thing. So we're trying to go throughout their day. Again, these are just some guidelines to think about again. So that desks should be 6 feet apart, as close to that as possible, right? So now if you divide the class from 24 into 12, you will be able to hopefully do that. Now, if you have already a small class where it's only 12 kids in there, that changes. But if not, this is something that they're recommending, that they highly recommend. But again, the state had kind of kept it that way just due to circumstance. But they might change it now if the numbers go back up. If the class is not big enough to keep the students 6 feet apart, consider dividing the class into 2 groups, which we talked about. The desks and classrooms should be facing one direction. Try not to have students facing each other, right? So everyone focusing in one way would be very important. Consider having attached shields in the front of the desk if financially feasible. Some they have these, or they're buying these portable covers, so that way in front. So if the kid gets tired and they move their mask down, they want to talk, or they're just having there's another shield there. So that's something that we're looking into pricing too. And so that's something that there's more and more like newer devices. People like this is a new business model. So everyone's thinking of new ideas of having shields. So if it's these little portable ones you just put on front of your desk when the kids are there. So even if that mask is there, now they're bringing it down, it's still covering from their particles to go to another child or moving. So kind of keeping that in mind. Again, financially it's going to cost, so there are going to be some things that we have to consider. Have the teacher in front of the class and walk around between the students when they need to, right? This is only if they need to, but the teachers, we should give them a mask, face shield, and gloves. We're telling our teachers you need to wear gloves the whole time. So when you're collecting a piece of paper, we're going to limit paper also passing out, but even that the teacher should just be in the front unless they need to. It's rather have the teacher walk to get something than sending kids to walk around and collecting papers from students and so on and so forth. So keeping that in mind. So number 6, again, limit paper assignments when possible. Number 7, have teachers grade all the assignments in school and not take them home. Even if we go 8-1, we're recommending our teachers that, hey, if we go in person, again, I just wanted to tell you, we're not officially in person. We are just planning if we go in person, and whenever that happens, could be November, could be January, that even if you're grading, it's best to, even after school, stay there, grade everything there so you don't take things home. And that if that, you know, and because when kids have to things get collected back, that might be problematic. So keep everything in school, graded there, have your gloves on, and do all the grading. Number 8, students should limit moving in the class and in the halls. It is preferred to have teachers move, not students, right? So we're thinking just due to the number in our hallways, because they're small and everyone's always moving, having the teachers go and the kids staying in one area, and the teachers when they're walking, that's why we don't want them to walk between the kids, that when they're walking in. So you want to look at wherever your door is, we want to have the front of the class there. So the teachers, when they're coming in, they're just coming in. They have masks, have a shield. We might even think of putting a big glass or these portable covers. So that way, even if they take it out, they could speak, but it's not, when they're projecting, the particles are not going towards the kids, or at least they're 6 to 8 feet apart. They have their mask. To take the mask out, they might have a shield, or we might get a big portable thing. So there are things that we're considering that I think, and I've seen from other schools kind of consider will be very important to keep in mind. Number 9, possibly keep several windows open for air circulation. That is something to think about if you have air circulation. Number 10, consider looking into air purifiers, air filtration. These are pricing we're looking at, what are good ones to have in the class and maybe in the hallway. Because what we want to do is to say, hey, we're trying to provide all our protocols to make things much, to make it's safe for the students, right? And as what we want to try to do is do our best, so Allah will take care of the rest. So if we go in person, we want to, at least in our minds, because these are kids, that we're trying to provide all the safety protocols possible that we can, and inform the parents what we're trying to do and what we can't do, and then ask whichever supplies that we can't do, maybe the parents themselves can bring. So kind of keep that in mind. Number 11, spray bottles of cleaning disinfectant should be readily available in each classroom and share spaces for use throughout the day, right? So having that in the office and bathroom, stair handles should be cleaned multiple times per day is very important. Number 12, possible installation of physical barriers, as we talked about, sneeze guards and partitions in shared areas where it's difficult to remain 6 feet. So I think that's our thing. So even the main office, you need to think people come in, right? So having some form of shield, you see that in many stores right now. So we're going to have to think about this. Why I'm bringing all these lists are because as board members who are here, our Sunday school, all these things are going to have to be to consider if you're having this, right? So from a full-time school to a weekend school to a Dar Ulum, wherever these are going to be things to consider if we go ahead and do this. Number 13, declutter classrooms as much as possible with the intent of maximizing floor space. So limited shared space such as instructional breakout tables or group assignment desks. So we're going to have to realize this is one of the few things we're not going to try to do a lot of group work, right? Science, where everyone's working together, close proximity, dissecting. This might be something where it's going to be a little different, or at least we recommend to be very careful, because you want to make sure you're not putting kids in situations where they're so close that there could be some form of kids to get contaminated, not I say contaminated, but get the virus and stuff. So Allah protect all of us, inshallah. Frequently clean and disinfect commonly touched surface daily, including desks and door handles. And this is why your cleaning team is going to be someone you're going to have a meeting with in a discussion and how and what the plan is going to be. If a shared classroom is being used for special classes such as computer lab or gym, the room must be thoroughly cleaned before the room can be used by another cohort. That's why you have to look at, if you're going to go there, it's better just have someone come to there and even ask like the art teacher to like try to do projects where they're not too much involved and they can still do it on their desk, right? So these are things that we're going to have to consider to play a part. Hallways. So now we went walking in, locker, a locker, classroom, now the hallways. Limit students walking between class periods. And that's one of the reasons we were thinking you have to look at your building. If it's big and so there's really only one class at one side, no problem. But if you have a school where people have to cross back and forth, then it becomes problematic. So I would say limit students walking between class periods is very important. Water fountains should only have water bottle access and not drink from the sprout. So you're going to have to change your whole water fountain where you could take your glass and bring the water in and not go the other way. So that's something that's going to be very important. Number 3, have hand sanitizer available in the hallways too, if possible, where you have that, at least in the classrooms, so when they're going, but just kind of keeping in mind and looking at areas where you might want to have something. So if they're in the gym, making sure there's something there if possible. When possible, when possible, keep all classrooms in the hallway doors open to eliminate the need to use door handles. Be mindful of the fire code and student safety when determining them. So if you have hallway doors, it's something to keep in mind. So that would be something to kind of keep in mind. Official phones should only be used by designated individuals, right? So kind of keeping that specific thing in mind regarding official phones. That when they're using your secretary, you want to make sure that those are not being used by other people, just also for her. So having wipes, you could wipe down if people have to use the phone or kids that have to come downstairs. But again, you're going to limit the designated person to use the phone. So also to keeping the office staff safe and secure also. The bathrooms, again, we're going to go over Q&A. I just want to kind of first get you some of the details. Bathroom capacity should be restricted to 3 students. Number of stalls, students should be wearing masks and remain social distance. A sign should be posted for them. Highly recommend to have assigned time to use the bathroom instead of allowing students to choose. So having set schedule for bathroom, that will help the cleaning person too. Like this new group's coming, clean, having the other person, even having someone in your cleaning just assigned to the bathroom area. Because that way, if someone uses it, they could clean and get the next individual. But now if we could have the touchless, that's going to save some of your cleaning too. Because now if the toilet's touchless, unless they, if it doesn't want, they still have the button, but the faucet's touchless, the napkin's touchless, these will be there. Even if the toilet isn't touchless, but by the time they go into the bathroom, they go in, wash their hands, which is a touchless. The napkin's touchless. That's also limit some of the cleaning, or at least make it easier for the cleaning team. If it actually possible, as we talked about custodian, having someone designated for that. There'll be no, okay, these are just some suggestions for our school. We're deciding, hey, we're going to go 8 to 1. If we go, again, remote learning, if we do that, then we will not have no lunch, but we'll have snacks from home that will be eaten in the classroom. So they could have those specific kind of things to kind of keep in mind. So I think that would be very important. Garbage will be thrown in a systematic way. No crowding of students by the garbage can. So we're even saying, hey, if suppose someone's eating snacks, we don't want everyone kid to go. You got to think about that. Everyone kids goes, throws the garbage, and say, hey, just stay there. When you're leaving, you just drop it off. But if they're staying, then you're going to have someone assigned to walk by and they just throw the garbage in, then having 15 kids go straight to the garbage can, or you assign one at a time to go. So these are things to kind of keep in mind. And snacks should not be shared. Food and drink should be covered and not when not being consumed. So these are things you're gonna have to educate the kids also. Fever and symptoms, we're almost there. Any child who develops signs or symptoms of illness while at school will be sent down to the nurse's office, right? And this is where you're gonna have to tell them that protocol, that if they have the symptoms, parents will be required to pick up children. If the temperature is 100 or higher, call parents to come up with the child. So if you know that temperature is 90, 100, they need to kind of come and pick them up. Then the child is going to be limited in that room. You do not want the child to go back upstairs, right? And then you want to realize that 72 hours, that child, until the fever goes down, they need to stay there. But that guidelines might change. So you need to speak to your local health department if that's later or if it's more hours now. Because again, things are changing with this whole COVID. So keep that in mind. Now, if the student has sent home, they're going to have to go to the doctor and check for symptoms from COVID-19. Parents should be encouraged to read the CDC guidance for caring for oneself and others, right? And then the other key factor is going to be, if child tested positive for COVID, they should remain at home for 14 days. So that's going to be something to kind of keep in mind, right? So if child tested positive for COVID, they would have to stay home for 14 days. And that whole class, you're going to have to inform them. So that changes the whole kind of scenario, right? If the child's tested negative for COVID, they should remain at home until the symptoms disappear. So if that cough, cold, they might just have a common cold. And then you got to get a doctor's note just to make sure and say, hey, that's there. So these are some protocols. And again, things might change and the rules might change more. But these are things that are going to come in place. So parents understand that, look, if this happens, look, for the greater good, we're going to have to make these specific rules is going to be very important. Right, we're almost there. I know I'm talking a lot, but these are slides that we had to go through. But visitors and volunteers, limit visitors, cancel and postpone any school-wide events. Right, I would tell you, like, first, having visitors at the school, not a good choice. And then after-school activities right now, because that means you're gonna have to do more cleaning to keep up with stuff. So if that means you could do Zoom kind of clubs, that might be like a yearbook club where they still need to maybe work on the yearbook, maybe we could do it through Zoom. So some sort of like student council, maybe through Zoom, right? Keep accurate records of visitors and volunteers will be also very important if you're having people coming in, just in case. Extracurricular activities, same thing. Athletics, we are waiting for more guidance for now. Athletics are canceled, right? In the summer, they started letting them have practices, but then they canceled some of them because kids were getting sick. So there's a lot of different changes. Are they letting them outside and not inside, but now they're giving them inside with a certain amount of limits. So anyone who's principals here, administrators, boards, look at the newest policies with the IHSA of what's going to be happening, because things are changing. This whole COVID, things are changing more and more and more. That's why even remote learning, which looks like it's going to be a high percentage, that's how it's going to start. They just sent guidelines a few days ago, right? So clubs may prefer to meet on Zoom and other online platforms. Dismissal procedures, parents stay in the vehicle, right? Half students walk to the vehicle, half students walk down from the classroom. This is going to be important, right? Before, parents used to sometimes come on in to pick up their kids, but the parents are going to stay in the vehicle. The second thing is half students walk to the vehicle, right? That will limit from kids having that. When the kids' name's called, send them, so not everyone's outside in a group waiting for their parents. Have students walk down from the classrooms, limit students touching their stair railings, doors, and walls. Have staff assigned by the doors and in the parking lot. So kind of keeping those specific things in mind will be very important. So I know that was a lot, but this were some just things to have, and there's a lot more that we could talk about, like in details. But I think few things that I wanted you to go from starting to the end. And now there might be minute questions, but again, these are just suggestions, guidelines. We are not responsible. Speak to your lawyers, your doctors, your whole COVID team, and what you think is best for your school. And again, when we're showing this, does not mean that we are saying start in-person learning or a hybrid. We're just saying, if this happens, here's some things to consider. So inshallah, hopefully we understand. Please, if there's any questions right now, we have about 20, 30 minutes, so inshallah ta'ala, we have time for Q&A. Brother Abdullah Mitchell.
Assalamu alaikum. All right, yeah, there were a couple questions. I'm sure there'll be some more as we go through the process. But can you explain what is being recommended for contact tracing? Are you making any recommendations about that? What guidelines has the school authority shared with you? Because it's one thing to say, hey, this person is sick, and if they've been exposed to other 12 or 25 kids, what is the steps that should be taken or suggestions?
So, but anytime anyone gets with COVID and they're being positive, they find out they have results of having positive COVID. One thing you need to do is call your local health department. Like for us, example, in our area, we would have to call the Skokie Public Health and say, this is there. That's why before school starts, you want to talk to them and say, what are the newest updated protocols? Before, they're like, when I was talking, we were thinking in the summer. So they said, if you're going to do something in the summer, something happens, you need to inform them. Then we need to tell all the parents of that class, because everyone has, when someone in that class has COVID, that whole class has to stay home for 14 days. Right? So that's something to kind of consider. Now, it might change, but that was a recommendation. It's not going to like, so that's something that at least us as our school, if we were going to do that, and if someone in that class had COVID, we would have to inform their parents, and then everyone is learning from remote learning. So that's something to kind of keep in mind, but you would have to speak to your local thing, because that way they get that name, and then that way they'll help us with the whole tracing process. Right? That's why even when we're doing that temperature check and the child comes in, but someone gets 101, you're like, hey, you know what? Don't come in. You still need to write down their name. That's why I kind of said, hey, got to get their name information, because you want to be like, hey, you have to follow up the next day and say, hey, what's there? Yeah, no, they do have a fever. Okay, are you guys going to doc? Because yesterday we noticed that you had 101, so you can't come to school for 3 days. So that's why even if we're doing the temperature check, whoever's helping you, and if you're letting someone go, you need to write that down. Like, hey, Habib, was asked not to come out of the car. They had 101. We need to call them up and find out and say, hey, no, it was something else. They're not the fever, but hey, we still get a doctor's note. Then the doctor note says, yeah, it was just a common cold. So that's the part that you could do is we just giving information to our local health department, and they can help us guide them, how we should follow procedures.
Alhamdulillah. Another question. What about waivers? Have you guys discussed about a COVID-19 waiver that parents sign, students sign, and what discussion have you had around that?
So for school waivers right now, what's happened is that many of the, I would tell you to speak to your legal department. We spoke to the governor, Jesse Ruiz, deputy governor, Jesse Ruiz. He had said right now, the state is not protecting schools from liabilities. So we're going to have to do our proper diligence of following the guidelines and doing all our proper procedures. Speak to your lawyer to have their own. So the state is not giving a specific liability for them. You know how the state has protected the police department? I mean, not the police, I mean, the medical workers, but not for schools right now. So I just want to give you guys an idea to realize that you're going to have to do your own due diligence in following. But right now, schools are not protected from liabilities. So keep that in mind. Speak to your lawyer. Follow the protocols as possible if you are considering in person. But I just want you to tell you that it's not that clear cut to say, hey, we just do that part. So we just want to follow, hey, we have this. You still fill a follow-up. I think you still do a liability, have them sign. But I just want all board members from weekend school and full-time school to understand that there's right now, there isn't. The federal government is trying to work on kind of bringing something to protect us, but states right now have not. So but still has not gone through yet.
Alhamdulillah. Also online right now, we have Dr. Kamal Al-Dawri, who is the chair of the CIGC task force, and some of these issues they've touched on, and he would like to offer his insights as well. Dr. Kamal.
Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakumullah khair, Dr. Habib, for this very informative presentation. I just want to highlight a couple of things. Brother Habib covered almost everything. We are not recommending any type of reopening. It's the decision of the school itself and its community and its stakeholders. So basically, that's something you want to discuss at the school level. I just want to comment on a couple of things. If you decide to return to in-class learning, we are recommending that the first few sessions focus on the cleanliness practices, hygienic practices, and measures the students can take to minimize the spread of the virus. Putting a mask on the face is not a guarantee for 100% protection. It should be properly basically worn. Students need to learn not to keep touching it and so forth. So there has to be some teaching around that. Face shields, although they can help with some classes, but face shields are not as effective as masks, but in case you need them, you want to keep that in mind. As you increase the use of disinfectants in your class, in your school, we are recommending that schools pay additional attention to students and staff with allergies, with asthma, and with breathing problems that might be exacerbated due to this increased use of disinfectants in the school. Jazakumullah khair. Go back to you, Brother Mitchell.
Thank you. Another question is really directed to implementation, and Dr. Qadri is directed to how are you going to enforce? Like one example given by one of our viewers is, what about the students who come in, they wear the mask covering their mouth, but it doesn't cover their nose, so there is still, through that breathing process, it's really not being fully effective. How do you intend, or what suggestions, what discussion has had around enforcing whatever protocols, practices that are developed?
I mean, one thing that has to happen after you decide which way you're going to go, like, for example, we just did this presentation. we're going to do the same presentation to the parents and make them understand why this is so important, right? So first and foremost, for implementation is going to have to first educate the parents and saying, this is going to be very important. Second of all, as Dr. Kamal brought up, is the idea of educating the students also and saying, look, this is for the safety and security. We might even have a Zoom just for the kids and saying, look, middle school guys, keep this in, middle school students, think about this. Elementary students, think about this. So educating the parents. So that's why even a third survey, we're having a separate one just for early childhood, elementary parents separately, and middle school separately, because each dynamics is different. Early childhood is going to be tough with the 3-year-old, 4-year-olds where they to keep their mouth all the time. That's why we were looking into things like, okay, if we have the mask, then as a double thing, having that portable shield as a backup, so in case they open it down, like we're trying to figure out if they don't do this, what's the other option that we have to protect them, right? What can we do with teachers, as it was brought up, right? That's why I say when the shield, one is the N95 mask plus the shield. So even if the teachers have breathing, that's a different layer. Then maybe having in front of the teachers another a shield. So these are all concepts that we're kind of looking into, say, hey, look, step one would be this. What's a second barrier? What could be a third barrier? So educating the parents will be one, educating the students, and then our own teachers are going to go through a whole process too, where we might have a doctor come in and say, what are all the protocols you could do to make it safer for you to participate and help making sure kids are learning in the proper way.
On one of our participants kind of gave a question, it's really like a further insight. What about the situation where you have a teacher who's teaching multiple classes, a student in one of those classes has a fever or maybe a COVID? Does that mean all the students in all the classes that that particular teacher now need to be isolated for 14 days? If you have an answer. I mean, it's, like you said, we're not offering legal answers to these questions, exactly, but we're posing problems for decision makers to think about.
And that's exactly the question that you have to think as that and say, look, how would you do this? If that teacher who's going to each class and you might, that's what some parents are like, well, some, administrators are like, well, if you move the kids, that might be better. I'm like, no, but when you move and everyone who that's walking in the hallway could be affected. At least, if the teacher moves, which classes we have to talk to. Everyone's going to take it. We might take a more conservative approach and say, look, that all the classes that teacher went to, everyone has to stay home and you're going to learn from online, right? That might be something that has to do. That's why you have to think about all these factors and making sure that, do you really want to open in person, right? And that's the whole idea of this. This is not like, hey, in person, this is what you have to do. These are things you're going to have to do. Now, is this, after knowing this information, do you really want to open up in person, or do we go ahead and delay it and do online, or at least inform parents and say, this is the reason why we might not be able to do it in person, because this is how all the things are going to play into part. So it's going to be very important, because if a school is only 50, 60 kids, it might be doable to just do it this way. That's why each school, now we have a different number. We're about 700. So we're looking at a different approach than someone might be having 100 kids. Some might have 300 kids. Some of you have a weekend school, right? So that's why it's so important. Look at this information, have your own internal personal discussion, talk to medical advice, talk to your lawyers, talk to administrators, and then make that decision. So I really want to reemphasize, when this is brought up, does not mean we're telling you to go in person, right? And that question, that whoever brought that up, is very important, because that's another factor. How many people, if that person went to every classroom and your doctor and your health department says, yeah, everyone needs to be informed now, it is, and then you're gonna have to think of plan B. That's why everyone has to right now prepare for remote learning. You have to have your teachers ready to be remote learning for sure. I'm almost guaranteed that's gonna happen. Now, the in-person is, in case if it happens, these are the things to consider and say, are you ready to do all these specific requirements or recommendations? I should say recommendations that are being from the state and stuff.
Considering that remote learning is likely to be a staple of future learning, what recommendations or what advice, counsel will you give our participants, how they can bring themselves up to speed on learning the latest practices, what the equipment requirements are, even to actually implement a remote learning process?
Right. I know everyone has to become kings of Zoom, but after that too, but you're going to have to look at different programs. Like there might be a Seesaw, there's Google Classroom, right? There's like a Microsoft opportunity. There's various, stockyards. There's a various forms that people are using, and I think you would have to look and do your own studies of what your capabilities are. But and then training our teachers, I think that's a given fact that has to happen to educate them. And again, as I said, just 2-3 days ago, they gave a new learning requirements from the state, especially because they know that it might be remote learning. So please, I think Dr. Brother Shah, I think I sent it to him, and so I think that should be sent to everyone to getting the new learning standards from the state that just were received. So hopefully that will kind of keep everyone in mind as we're going through this whole process. But I think it is very important. You need to educate from an administrative standpoint, teachers, and best practices. So it just can't be, remote learning cannot be what happened in spring. Okay, I'm going to reemphasize this again. For any administrator, for any board member, you cannot do the same kind of remote learning in spring. Spring was emergency. So there were like no guidelines. Okay, just have 2-3 classes in a week. Now this might be something like 4 hours straight. You could grade. If child doesn't get on to the class, you could deduct them unless they have no resources. Then you need to have it taped and you can send so they can see it later, or you have to provide them a laptop or something just to help them if that's something that your school could do. So kind of keeping these things in mind is very important.
Has there been discussion around the financial impact of some of these things? It's clearly we're talking about spending more money.
Yes.
And not every school has a budget that, following up on your last comment, to buy a laptop for every student who doesn't have it. So how do you see this is affecting maybe the tuition or the fees that are charged? One participant was suggesting maybe this could reduce the price because you're not as remote. But how do you see that, and particularly from an economic aspect? How do you see this impacting the budgets for schools?
So for a private school, if it's a full-time school, right? For full-time school, it's tough because your teachers are getting paid. So one of the things we're trying to do is that what we've thought is that there are some parents who, for the greater good, might still able to pay the full tuition. But we're looking at it like if there are parents who need, like we did this in the spring, if they need some consideration or support, we're doing it case by case, because that will help us kind of work with it. Because if you do a complete flat, we're going to be like, what are you going to do? Tell all teachers, hey, guess what? Everyone's going to have, because we're getting 50% tuition, everyone's going to get 50%. Their salaries are going to be cut. So again, that's something I think everyone's going to have to discuss in their own our schools. But I think that's there. The CARES Act. I mean, one of the things that even our own lobbyists from the coalition got us money that way when we had that first CARES money that came in for the PPE. It was very important, like for all that loans that all the schools got, that before, just so that we got involved. We also have a lobbyist right now to making sure CARES money. And there was a concern because the CARES money for private schools, there were some concerns that, hey, well, why are private schools getting the money? Also, so they only get Title I money. So there's been some limitations on that, which the federal government was giving private schools the same amount as public schools. I know there's like Chicago Public School just sued the federal government for it, right? So there's some stuff from a private school perspective that the federal government's been trying to help us out. So I think those are kind of things that are going to be factors. So that's why for in-person, you're going to have to budget this and saying, okay, if we go in person, how much of this is going to cost us, right? And again, the state, federal government's not going to constantly bail us out. They might just completely collapse. So I think it is something that as your boards are going to have to really reconsider looking at all these facts and say, if we go in person, what's going to be the cost? How are we going to do tuition? How are we going to pay our teachers? These are conversations. Do we tell, hey, teachers, we're going to have a salary freeze this year and we'll see until fall, and then, maybe compensate you by Eid bonuses. If it's a weekend school, if we're volunteers, you can still do remote learning. So you have a Darulum where you're still paying teachers after school. So it is financially, I would say there's no one answer because every state's doing different things. As I said, some schools are doing different factors. Where there's one high school, like a Catholic high school, they're doing freshman classes are on Monday, sophomore classes on Tuesday, junior classes on Wednesday, senior classes on Thursday, Friday. One of the groups gets back one more day, repeat. But then now the parents were at that school, it's a very popular school. They're like, well, then we should only pay 25% or 50% of the tuition. So there are constant issues, not just for us, all private schools and higher education. Is it the whole thing? Our Harvard University right now, we had our meetings, Our PhD program this year, we just closed it. We're not doing a PhD this year, but our master's program, we're not doing inside, we did it out. So it's the first time ever the whole master's program 1 year is outside the country. And because it's, not inside, you don't have to physically be in Cambridge, we had more than 5,000 applicants, because now you could do your master's from Harvard from anywhere in the world online. So you see that there's just all these challenges. So it's not just us. So everyone's kind of looking at each university doing their own thing. Some are open, some are not. Michigan State is letting students come in, but if some people don't want to. So there's a lot of different conversations. Even Notre Dame had that. So I would tell everyone, I don't really have the answer. I would say you need to, and your own team, have that final discussion.
What one other question, Dr. Kadri? What how do you, right now we're in phase 4, i.e. Here in Illinois, and what that means, it seems like to go to the next stage, we need a vaccine. And if one of the our participants was asking the question, how is that going to impact? If you have, some parents may say, oh, we don't believe in the vaccine. We're fearful that this may not be a safe vaccine. It was rushed. Maybe it has a rushed approval. And I know we're talking looking down the line, but as a, let's say as a potential question that you as administrators will face, has there been any discussion around this in terms of how these state guidelines, to the extent that there is that as alternative, if vaccine, you can open up and you have part of the family saying vaccine, everybody get vaccine so we can reopen, and others having that fear. Has that been discussed at all?
And that has not been discussed right now. I think when that comes in, I think the CDC will give us some stuff in our local health department. I'm a big believer working with your local health department. We have a great relationship with the Skokie Public Health. Because everyone gives you ideas. You have parents who are doctors, community members, you have people who are, they have like their conspiracy theories. Everyone gives you. So I've always say, hey, let's try to figure out. Then we do our, get all the homework, get all the information, have that discussion, follow through, and see what the best thing is. So I don't know right now. I think that'd be something Dr. Kamal might know more information about. But I think when it does come up, whatever the guidelines are, we have to reevaluate it, look at it. And I think some schools also have that challenge where just the flu. Some people don't take, even though there's school requirements for some specific shots, some families who try to not want to participate in those. So those are always our ongoing conversations that schools already have. But I think for this one, it is something, but I don't know from a medical thing. And I would pass on that. But I think Dr. Kamal's feel that he might have more information on that.
I can add to that, to what you said, and I second what you said. I think we are, they're talking now about a vaccine that might be available at the end of the year. Now, it's going to take a long time to vaccinate and to everybody, or to vaccinate most people, so you can have this, what we call herd immunity. Dr. Fauci was asked about the situation a few days ago, and he said we are at least 1 year from going back to semi-normal situation. So we are in this for quite, some time. I think at least for the fall, we probably will continue with either remote learning, some kind of in-person, and probably mostly remote learning. And may Allah help us in the spring and things will be easier. So, Jazakumullah khair, brother Dr. Qadri.
Another question, and I know we're starting to get to that, your critical time now, but a question I think that is kind of resonating through the comments made by our participants is this whole question of how do we demonstrate value for parents who are to make the argument that you just made. Well, they're only hitting in school 1 day a week, so we should only pay 20% of the tuition. Not recognizing that. Has there been discussion, or how do you think this can be promoted? Because this is the challenge, particularly for small schools, where every tuition dollar is vital, where you have teachers making tremendous sacrifice, compromising on their salary just to be a part of the school. So how as a community do we address this problem?
And I think that's where two things from the school's perspective is that we're going to have I realized one thing when you work for religious institutions, right, there's a lot more negativity than there's positivity. So sometimes, and I know in our faith, it's nice to be humble, but I realize sometimes we have to share like some of the things that we are doing, right? And I think one of the first things we got to make sure as schools, we're doing everything possible. Like we're doing our best, so Allah will take care of the rest. And saying, hey, we're following all the protocols, and then even teaching, we don't just have to be average. We have to be above average and say, look, we are going to try to do all these things to make sure learning is happening. So that's why even if we do remote learning, I want parents to be very clear. That's why we saw in the survey, we put in parentheses, it will not be like spring. Spring was okay, everyone was understanding, but in fall, if we do go ahead, it might be like 9 to 1 where it's online, next period after next period. We are going to make sure our teachers are very well professionally developed so they'll be able to maximize their teaching skills online. And I think what we want to show is that, look, what can you do? If you could pay full, we would really highly recommend it. If there's some discount, I'm a big believer, let's do case by case and not like a flat 40% off, because there's some people who understand for the greater good will do this. They're almost doing it like as a donation because they want their institution to keep running. So I think that is going to be the key factor by showing them all the things that we are going to try to do to really maximize learning and everyone to buy in, and then understanding that, look, you know, when we first did this survey in spring and when people were asking for discounts, we did, but we wrote a thing and said, look, this is how much we collect, right? When we collect, that still doesn't balance our whole budget, but this is where how much tuition really benefits and why it's important we need this tuition. So being transparent and understanding of why this is very important. Most people, may Allah bless our parents, because they already are somewhat committed to the schools. So they understand that. But at the same time, if they realize we're being flexible and so, like, we can give you 20% or 30% and work with their circumstances, I think, you know, that give and take helps people buy in, right? And I think when people just say, well, we're not doing it at all, we need to take a stand. That, again, every board has that. I'm a big believer, like, when we could go meet halfway, it blesses and people remember that. And then some people later on, if things get better in Ramadan and stuff, sometimes, you know, they'll be like, you know what, I'll give you a donation for this so I can get a tax write-off to balance off. So you just got to look at different ways to kind of help with the situation, inshallah.
We're about, about 10 minutes after, and maybe I can ask a kind of final question.
Sure.
That one of the problem that seems to be running through even in your surveys has been those parents, maybe that's both parents are working, and to the extent that our school doesn't answer or provide a solution to their problem, they're likely to pull out and find somewhere else.
Mm-hmm.
What has there been any discussion around that maybe there's some sort of after school program for a limited number of students or something like that? Has that been a part of any of the discussions among school administrators? And if not, do you, what solutions or proposals would you offer our leaders here today to consider?
So one of especially like you see preschool, pre-K, kindergarten parents where they're trying to, you know, that's where you see like a lot of parents who bring their kids in Islamic schools, weekend schools, full-time schools. And so one of the things that we're looking at is, suppose we're thinking, now, as I told you, we're going to do a third survey, which is going to be early child, to say how many parents need to have your child in person. Suppose we get 20. Then we could consider and say, okay, just for these 20, you understand these are, and now we don't have to worry about 100 and say, like, these are the only individuals that will be here. It's something, again, we're not for sure doing this, but we are going to try to get a better idea how many of even early child parents don't mind just remote learning, even if it's a discount, but how many people really need this? And if there's a small number, can we maximize this, or can we do this? Or do we have a teacher who's buying into it? We may have some teachers say, look, I don't mind doing the remote learning and I don't mind coming in. That is something that we're going to have to consider and participate in. So I think that is something that I would highly, I would say, do some more research and then figure out how that could be done. And that's something that we're considering too, because you know, like right now, daycares are still happening. So I've been trying to call daycares and saying, what are you guys doing and stuff? And but they got the waiver liability, and they're trying to keep kids only like 4 in a room. So I think those kind of things that could happen. So I would say, do a personal survey, figure out how many that is, look at if that's something that's possible. And then one of the other things I forgot to tell you is that remote learning, if suppose you were doing hybrid, one school was saying, hey, if they're going hybrid, like if you're going to go remote learning, you can't come back for a quarter. So when you buy into remote learning, don't come back like, oh, I heard it's been good, I want to come back. So that way they know that they're only dealing with these many in person. If you're doing this hybrid or even doing a small group of groups for parents who are there. If you're doing after school care, it's the same kind of situation because you're still dealing with these same procedures, right? There are issues of procedures and following through on those procedures, because even if it's after school care, one kid gets sick, all 14 might have to stay home then. So parents need to understand that, right? Even in daycare, they're supposed to follow that. Again, I don't know, it's not official. These are recommendations, right? But then, you know, you don't want to get that liability on you like we didn't follow what was recommended, right? So, and especially private schools, there's a little bit more leeway, but, you know, I, as administrator, because at the end, it's about our kids, even our staff. I'm sometimes more worried about our staff because they're older, right? And there might be development. People have diabetes. People have different kind of health issues. So I think it's something that we have to consider case by case.
Well, you've been a wealth of information for us this morning, and we could probably keep you here for another hour asking further questions. But we do appreciate, Dr. Qadri, the time you've shared, the information.
I haven't finished my doctor's yet. You know, make dua for it.
Alhamdulillah. Well, I get in our mind, you're our doctor. Okay. All right. But the other thing I would like to remind everybody, yes, if we if you have not given in the registration process your email, please put it in the chat. We will copy that and ensure that this presentation that you have been given here by Habib Qadri today will be forwarded to you. And once we receive, I'm assuming we have those guidelines that he referred to from the state education authorities, we will also forward that to you. And inshallah, within by next week, we will beginning of the week, we should have this webinar up on our website so you can have an opportunity to hear it again. So at this particular point in time, we're going to call it, bringing this to a close, but we would like to have some parting words from our chairperson, Dr. Urshad Khan. Yeah, everybody's not a doctor.
Assalamu alaikum. No, definitely not a doctor and not in the class of Brother Habib Qadri. Jazakallah khair, Brother Habib Qadri, for a very informative session. Learned a lot. As we put out the disclaimer, this is just a guidelines, recommendations. Every school, every school authority has to look into the local guidance and then follow through. So this is a good start, alhamdulillah. CIGC is making every attempt to bring this timely webinar to help our community, especially in this COVID-19 situation. So thank you for everybody attending it. Please share your email. What Brother Habib Qadri mentioned, we do have Illinois Fall 2020, Illinois State Board of Education have given some recommendation. We do have that copy. If you need a copy of that, please share your email. Inshallah, that will be forwarded to you along with the presentation. So I don't want to take any more time. Thank you for joining. Jazakallah khair. Assalamu alaikum.
Assalamu alaikum.
Jazakallah khair, Brother Mitchell. Keep me in dua, Sheikh.
Inshallah, have a very successful meeting. Bring back some more good information.
Inshallah. Assalamu alaikum.
Assalamu alaikum.
Okay. All right. Okay, sorry about that.